Hi, good afternoon. Thanks for taking time and join us in the Facebook Live today. I'm Dr. Lau Sun Yan from Genesis IVF Center and the Women's Problem. And we are going to give a small talk, which actually is a big topic about we heard about PCOS, PCO, PCOS, polycystic ovarian syndrome, and the management towards achieving a pregnancy. I would say that this is a big topic because polycystic ovarian syndrome, or some people ask me what is PCO and PCOS. PCOS and PCO, the difference, the PCO is we are talking about your ovary, polycystic ovary, and if it causes some symptom or some symptoms, we call it PCOS, S for syndrome. Some people have this polycystic ovarian thing, but they do not necessarily have problem. Okay, I just found out they have this polycystic ovary. Now, it can cause multiple problems, or it may be asymptomatic. One of the things that people are more concerned is polycystic ovary. They do not have actual problem with the ovary, but the way they functioning is different. They have, in fact, many follicles, egg follicles. They seem to have a lot, but most of the egg follicles do not function in a normal way, like they do not grow from small till big and ovulation. They don't perform that way. That's why they have polycystic, but all of them are stuck halfway, but not reaching final. If they don't reach final of ovulation, they may not have a pregnancy happen. Or their ovulation happen the wrong time. They don't ovulation the right time, sperm don't come on time, they cannot achieve pregnancy, because everything for pregnancy, for menstrual cycle, they have what we call a circle. Once you are not within the circle, they are not in coordination, pregnancy can't achieve. Okay, and some people have the polycystic ovary and they have other symptoms because again they have a rhythm. Once the rhythm is out, it affects other things. Some have endocrine system problem. Let's say they have a tendency to gain weight fast. It affects the hormone. It's not that they eat too much, it's just that the hormone balance is that way. They gain weight too fast. And then you will go into different situations, like they're more prone for diabetes, they're more prone for certain cancer disease, like cancer of the uterus. Right? For those, they may need a treatment even though they're not looking towards pregnancy. Now, let's focus on the pregnancy. Polycystic ovary, you don't have an egg come out at the right time, the timing is lost, the sperm couldn't find the egg, there's no pregnancy. In order for that to be cured or to be treated, we do not just focus on PCO. For those who come with the problem we confirm there's a PCO, polycystic ovarian syndrome, or polycystic ovarian condition. We check other things as well, make sure that you have no tube problem, you're not blocked tube, sperm okay. Otherwise, you treat the ovary problem, you make it ovulate, but some other symptoms, some other conditions still persist, you still don't achieve pregnancy. But in the case that when the woman comes with just polycystic ovary, we help them in achieving pregnancy by stimulating the ovary. Stimulating ovary, they can be oral form, they can be injection form. At the right moment, we give a stimulation, cheat the body to stimulate the ovary to produce egg, and we monitor and see that if the medication is efficiently producing the target, that means the ovulation, right? Certain cases they might be a bit stubborn ovary. Stubborn ovary in the sense that you give medication, they still don't respond. And for those cases, we may need to do a more extreme way by giving injection. Injection compared with the oral form, it is different because injection, they are giving a direct order to ovary, must do it. Now, polycystic ovary, they are stubborn, but once they're forced to do it, they sometimes overreact. So the injection form, you overreact, you produce too many eggs. People say that isn't it good? I would say that isn't it dangerous? Because you want to try to go a natural way, you produce 1 or 2 eggs a month. Alright? If you have produced too many eggs, what will happen? Well, chance of getting pregnant well, maybe higher because of multiple eggs. But what if you're pregnant with a twins, triplet, quadruplet? That is a disaster. Alright, so we have controlling the ovulation with oral medication and occasionally with the injection, but in very careful control. Okay, now if some people they still do not achieve pregnancy with the normal way of ovulation, sometimes we have to go into IVF. While to PCO patient having a different condition compared with other women when they go into IVF treatment, oh, they do. One good thing is that they tend to have many follicles. Many follicles, the more follicles you have, the more eggs you have, the more chance I manipulate it, the more chance some embryo form and a good one. But then they have a problem that they may go into a condition like overstimulated ovary, right? That is not a major problem, we can control quite well, but somehow the condition still exists. So for OHSS, for polycystic ovary syndrome, if they go for IVF, there are still more things to monitor, right? Okay, I think it's good for me to just give a briefing on PCO and the achieving pregnancy. I'm not touching another topic, right? Is there any question coming up? Now, why don't we give a brief on PCO? Let's say if you have a PCOS, well, you're not ready for pregnancy yet. Is there anything concerned in terms of health? Well, for some PCO patients, they have an irregular cycle. So irregular, we do not like it. Because the nature tells us you should shedding off the lining every month and reproduce a new one. Some people don't do that. They have an accumulation of the lining for too long. They lead to a risk of cancer of the lining. So if you are not planning to get pregnant, yet your cycle irregular, it's good advice. Try to see a gynae and take a look at the situation. Maybe you should consider inducing the menstruation every 3 to 4 months, or control your cycle using a form of a contraceptive pill. There might be options, right? And then as regarding to the diabetes part, they have a slightly higher tendency they may become a diabetes. Good to have a checkup. Okay. Other thing is the disturbing symptom of polycystic ovary syndrome. Like some women, they tend to have a higher proportion of male hormone, right? Higher proportion, not that they wear a lot. Then they start going to a state of they have a mustache, got more hairy, this sort of thing. This is more physical. While they need to adjustment, it probably takes some time for the thing to happen, right? Okay. Now, what else do I need to tell you about polycystic ovary? Okay, there are questions coming in before. There are people who actually say, beside giving oral medication, beside injection, what else can I do? My doctor have advised me to go for surgery. Well, surgery was is still one of the options, but it's definitely not the first option to get over the polycystic ovary. There is a condition that there are surgery to go in to do some burning on the ovary at a certain part. It may reverse the situation, but is it good? Now, let me tell you, it never be my first option, because well, you have to go through surgery. No matter how safe the surgery is, there is cost concern, there are always risk. And then the effect might not be achieved. And for those who have this dichotomy of the ovary or the burning of the ovary, the effect may not be long lasting. You may force the ovary go into an ovulation situation like normal people. It may last 3 to 6 months, and after it go back to their own way. So surgery would not be my best option in the treatment of the thing, unless a patient have a condition they need a surgery. In the meantime, I do a dichotomy of the ovary. That's what we normally do, but definitely not the first option. Okay. Okay. How is the PCOS diagnosed? Well, the diagnostic criteria has been there for years. Now the thing is that it make it easier. We just check it. We have to take 2 condition out of 3-4 situation. Let's say the scan show that it's a polycystic features, or the symptom itself can make a diagnosis. Sometimes we are not so sure, we might need to do a blood test to see that how's the hormonal balance to decide whether you are PCO. But mind you again, not all PCO need treatment. Some they have polycystic ovary, they do not want to do achieve pregnancy yet, and they have a quite irregular cycle. Just leave it that way. Okay? Now, what are the symptoms of polycystic ovary syndrome? Like what I just explained to you. Irregular cycle, gaining weight extremely fast. It can be as fast as you gain 10 kilograms within the last 6 months or 1 year. And then hirsutism, that means a bit hairy, increasing moustache, risk of diabetes, things like that, right? Now, someone asks you, if I have polycystic ovary syndrome, should I see a fertility doctor before trying to conceive? Well, a lot of people don't see doctors. They just try. But reaching a certain age, reaching a certain attempt, let's say you have been trying for 1 year or 2 years, even though you have those regular cycle type of PCOS, you should see a doctor. Right? If you have an irregular cycle, that is more reason to see a doctor early rather than late. Okay? Some ethnicity are more prone to PCOS. Yeah, theoretically, yes. And they even theoretically say that they are more genetic predisposition to the PCOS. Yes, definitely yes. Right? But whatever is it, leave that apart. If you want with the problem, you seek treatment. If you don't have this thing, good. Okay? Okay. Of course, PCO, they have disadvantage if we go for IVF, because in the PCO, all this they have a PCO polycystic ovary. That means a lot of follicles, but these follicles they are not supposed to follow normal routine. Normal routine is that every month when I have a menses, I don't have menses of course. Every month when you have a menses and the whole thing restarted, they're recruiting their follicle from a primitive stage until graduate means ovulation. But in the PCO, when you see the scan, they have multiple follicles. Those follicles, they may be accumulated over the last 6 months or 1 year. That's been there. They actually more prone for abnormal change or might not be that good quality. There's a difference between PCO and the normal ovary. Okay, doesn't mean that they tend to go to ovary cancer. No, not that way. All right. What can I do on my own? There's a question asked. What can I do on my own to lessen the PCOS symptom? Depends on what symptom you have. Some people having a symptom like they gain weight too extremely fast. This is a bit more difficult to achieve because it alters your hormonal system endocrinologically. You tend to gain weight faster. You don't eat more than me, but you gain weight much faster than me. Well, for those I will say that well, you have to do a bit, take a long-term plan, a bit more exercise. Exercise, the recommendation is towards aerobic or sweating out. Exercise, it will cut down the fat layer a little bit, it may reverse the situation, but do not expect well, fast effect. It probably take 5 months, 6 months to achieve that. And then a lot of people, they do exercise, they cut down fat, but they say that I gain weight. In fact, I said, don't worry, sometimes you cut down the fat layer a bit, but your muscle tone, muscle bulk come out a bit, that's why your weight come out. But if you achieve it within 6 months and your cycle go back to natural, regular, oh, that's good news. You consider it reverse, okay? There's a question asked which I'm not really sure exactly what it means. Can women be born with PCOS? That's I think probably like something like more a bit of a genetic predisposition. Some PCO, in fact, over the years, 20 over years ago when I was in England, my consultant tell me keep an eye on PCO because it is getting a higher tendency for women to get PCO, PCOS. Whether it's getting higher tendency to get that, or is that we are diagnosing it more frequently nowadays. But yes, you may have a tendency in the inborn, And some people, they have a regular cycle, and after some years, they just turn into polycystic ovarian syndrome. It happened. Okay? Does PCOS get worse with age? I can't really answer this one, because when you have PCOS, whether you get PCOS at age 30 or 35, it's still PCOS. Right? To get worse means that does it affect you with more symptoms? I wouldn't say that yes. Okay? But it's good to, when you know that you have such thing, diagnosis, get over it for any reason. For let's say for health reason, to get rid of the risk of cancer, lower your risk of diabetes, or to just to achieve a pregnancy. For all the reasons, you should go seek a treatment. Okay, now thanks for with us today. And if there is anything that you need to contact us again, you can just go through our Facebook Live. You get the email contact and the phone number. And then the take-home message for today is PCOS is not a cancerous disease or any bad thing, but it does exist. If you have a PCOS with symptoms that is affecting your lifestyle in terms of pregnancy, in terms of weight gain, in terms of hirsutism, means a heavy thing, I think it's time to get a treatment. Yeah. Okay. Thanks for with us today. Thank you.